You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's program is an extreme makeover show today. If you're not happy with your smile, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. Today's show is an extreme makeover edition. With us we have the hot dentist in town, cosmetic dentist, Dr. David Westerberg. Dr. Westerberg, welcome to the program.
Thank you, Randy. Good to be here.
We've had you on the program before.
Yes.
You just now, you have a brand new practice. It's been around for a while, pretty well established.
Yeah, established by Don Brown,
Sure.
And I took over the practice in August. I'm there with Patsy, our manager.
So you have the same staff? Everybody's
Same girls, yes. They're all there. They're behind me 100%.
Okay, good, good. Now you brought some of your photos.
Yes.
And you know, and I told you this, you know, our show airs about almost 6,000 half hours a month nationwide. We're in about 40 states. And I said, I see dentists all the time. I said, this work is fantastic. I mean, this is really good stuff. So good for you.
Thank you.
I mean, you definitely have an eye for it. But let's talk, you know, for those that don't know who you are, let's talk a little bit about your background, your training, how you got wrapped up in cosmetics.
I've been a dentist for 20 years now, and it evolved to where I was more interested in cosmetic dentistry and veneers, cosmetic crowns, just dealing with renewing smiles. I've been looking for a cosmetic practice for 5 years, and when I found this practice on El Paseo in Palm Desert.
Great location.
Beautiful, beautiful place to be, and I feel fortunate to be in such a beautiful office and area.
Now, you don't look like a dentist to me either.
No.
I mean, when did you know you wanted to be a dentist?
At a young age.
Like 10 years old, 12 years old?
Yeah, close, 11.
Really? And so what made you want to be a dentist?
I was always fiddling and building things, and my parents, I played musical instruments. They felt like I was good with my hands, and they suggested, here's some options. Dentistry, you'd be able to use your hands. The hours are good, and I never changed my mind since.
Is that right? You always wanted to be a dentist?
Yes, always wanted to be a dentist.
What kind of patients are you seeing there? I mean, I guess it's become more mainstream. People are getting veneers.
We see young, we see patients 70, 80, and 70 and 80 is like...
A 70-year-old could get veneers?
Oh, yes, yes.
Really? They won't fall off a 70-year-old?
Oh, no, no.
Okay.
Veneers today, the materials are as strong as natural teeth, and they tend to wear less, they stain less, they break less. And with regular checkups and good dental care, they can last a long time.
Just like your regular teeth, for the most part.
Very much so,
You know,
yes.
70 years old is young these days. I mean, it's really young.
It's
Especially
young in the desert. Absolutely,
so
yes.
more of those people are coming in?
Yes, so their teeth tend to be a little darker as you age, and the patients I see, color is an issue, shape, alignment of teeth. They're wanting perfection at this point, and color is usually what draws them in. When we sit down and talk about their smile, I'm able to show them pictures that are very similar to their case and see what we're able to do for them.
So you say you show them like smiles. That's what you're referring to?
Yes.
Teeth like theirs?
Yes, we have hundreds of patients in our computer, and we can pull up photos of very similar situations to most patients.
All right.
And give them an idea, let them see what they can expect or not expect. Some people's expectations, I have to let them know, this is what we can do for you, this is what we can't do for you. Back to the 70-year-olds, Randy, today they take great care in their skin, with their hair, their clothing, the cars they drive.
They're getting plastic surgery there. They don't even look like they're having facelifts.
They don't.
I mean, it looks good.
Beautiful, beautiful, and really take care of themselves. But where you notice is their teeth. And their teeth gives their age away.
Interesting. I mean, you see that as a dentist.
I see that as a dentist.
Somebody that looks great, they're well put together.
Fantastic.
And what do you
everything
think?
head to toe put together, and then they'll smile, and their teeth will show their age.
So why aren't they doing something about it? What's your take?
They're usually afraid of the dentist. They have fears from way back when they were children, and that sticks with a patient for a long time.
Okay. Do you still hear people say that I hate dentists? I mean, do you hear that today?
I hear, I hate the dentist, but not you personally. That's usually the line.
Is that right?
line
I mean,
we
does it
get.
come up every day, every week?
Once a week at least.
Once a week?
Yeah, yeah.
Okay. Now you say, and everybody on my program sometimes will say, well, we're changing people's lives. And you said that to me on the telephone.
Yes.
How
well,
so? How so?
You be the judge, Randy.
Okay.
I have a patient here, Rob. And if you look at his teeth, nice smile. Teeth are arranged
Yeah.
nicely. He didn't like the color of his teeth. Very gray looking. Whiter teeth is traditional of a more youthful, younger smile. And look at his teeth.
Yeah.
They show his age.
Okay, so what'd you do for him?
We did veneers, top and bottom, and that's his after
Wow.
picture. And certainly he looks more youthful.
He does.
His eyes, his face, just vibrant. Look at how his teeth follow the lower lip and contour. That's a youthful appearance. He looks more educated. His face looks more confident. Randy, let me show you another patient.
All right.
This is Annika. She wasn't happy with the gaps.
What does she tell you on a consult?
The spacing between her teeth, one side they look very large, the other side they look small.
Okay.
And the color. She's young, she has a little yellow look to her teeth.
All right.
But here, obviously, it's the size difference between the two sides. Here's her before picture, and here is her after picture.
Beautiful. Well, yeah, she looks like a more mature woman.
Yes,
Like
yes.
a young girl there.
Absolutely. She has beautiful eyes. When I first met her, I was drawn to her eyes, but I was distracted by her smile. And
Interesting.
I think people would look at her eyes and go, what a beautiful girl, but I think they were distracted by her smile.
What does she say? I mean, obviously this is going to help anyone's self-esteem.
She can't stop smiling. Yeah, she has
Is that
the
right?
teeth that she always dreamt of. And this was the final phase of her transformation.
Yeah, she looks fantastic. Very, very
Beautiful.
pretty girl.
Beautiful girl. Here's another case, and I want to show you his before pictures. And a very nice smile, arrangement of his teeth. Many people would think that that's a beautiful arrangement, a great smile. He didn't like the gaps between his teeth. Up along the gum line, we call them dark triangles. And the recession of the gums, that's common with an aging mouth.
When you look at that smile, what else do you see? Because they seem to be very flat.
Very flat, which
Kind
indicates
of a fangy
where.
look on the outside.
Yes.
Hope I don't run into this guy. He's going to say, why'd you say that stuff about me on the show?
He's a great guy.
Okay.
His two middle teeth are very teepeed and very triangular.
Interesting. Right, like
Yes.
a teepee.
And that formed the space between his teeth. Now look at his after picture. We were able to close that. He doesn't have those dark triangles anymore. The wear is gone.
Huge difference in this
Big
guy.
difference in color. Follows his lip line.
This is good work, by the way.
Ah,
I mean, this
thank
is
you.
really good. Are you proud of this? I mean, you must be proud of it.
Absolutely.
I'm trying not to endorse
Absolutely.
you too much, by the way. You
Okay.
know, I'm trying not to endorse anybody too much on my show, but this is some of the best I've ever seen.
Yeah.
And I see photos every
The
week.
outcome was
What does he say though?
he can't stop smiling either. That's common what we hear. They smile more. They're more confident. Someone that might be shy might transform into a social butterfly.
Have you seen that happen?
I have.
Over the years?
Yes,
Just
I
because
have
of their
seen
teeth.
that. Yes.
Even with a guy like this.
You're taking it for granted because you have a nice smile. You've
thanks.
had just minimal work, a couple of teeth here, but
A couple on the side, that was it.
a couple on the side, beautiful smiles.
Thanks.
This was a big difference for him.
Well, he has more credibility now. There's no doubt about it. I mean, this guy, you know, one of the things you said to me off camera, you say, Randy, if you were going to interview this guy for a job and this guy for a job,
Yes.
same guy, who would you hire? And the truth is, he does look more squared away.
Professionals are experiencing more success with their career.
Now, you're biased. You're a dentist. Every time I have a dentist on the program, they think the smile's the most important thing.
Absolutely, it's an important thing.
Why?
That's your eye is drawn to the smile. It's the center of your face. When someone's talking, you look at their eyes, but you're also looking at their teeth. While they're talking, their speed of their talking may change, the tone may change,
All right.
and your eye is drawn to the mouth.
One of the things you say that you don't want, when creating a great smile, you don't want your teeth to walk in a room. What does that mean?
You don't want it to stand out as, wow, look at those teeth, they were done, or boy, they look like dentures.
Okay.
They got to
Good point.
fit their complexion, and they got to fit proportions of their face.
All right.
Color is important. You wouldn't